So now we're moving on to anesthesia. Anesthesia, as you know, is defined as suppression of nerve sensations, okay? First thing I want you to do is I want you to turn to page 71 in your CPT book. Okay, so there's several types of anesthesia. There's topical or local. Topical meaning putting on the skin. Local, limited area. So think of like a dental procedure where they numb your gum, okay? Then regional, think of like a C-section where they numb the person from like abdomen above the belly button, top of the leg kind of thing. And then general is completely out. Okay. Then we also have something called moderate or conscious sedation. Okay, it's essentially they get something that reduces their anxiety and stress, but the patient is they are conscious. They can respond to commands. Okay. All right. All right, so let's talk about how to code anesthesia. The first thing that you need to know about anesthesia, when you are looking up the keyword, so let's say that you are coding for a mastectomy. Okay, so mastectomy meaning removal of the breast. You do not look up the word mastectomy. Because if you look up the word mastectomy, you're going to be taken to a surgical procedure. You are not coding in this case. You are not coding for the surgeon. You're coding for the anesthesiologist. Okay? So you would look up in the back of your CPT book, anesthesia, and then by the procedure. Okay? So if you look on page 71, you're going to see that under anesthesia, it starts from the top and goes to the bottom, okay? So you're going to see head, neck, chest, spine, abdomen, pelvis, legs, okay? So it's going to be by body part, okay? So go to the back and look under anesthesia. Just look at the word anesthesia. Okay, so you'll see anesthesia, and then you can see like arm, abdomen, biopsy. Okay, you see all these different procedures. So that's the first thing. And when you're coding for anesthesia, the first digit is a 0. That's how you know it's an anesthesia code. Okay? Okay. So here's some examples. So like anything on the larynx or trachea, okay? To look up anesthesia, and then either the body part, body area, or the exact procedure, like breast mastectomy, okay? So flip to page 72 in your CPT book, okay? And here's where we go back to these physical status modifiers. Okay, so look on page 73. All right, so it says, right under there, it says, all anesthesia services are reported by the use of an anesthesia 5-digit procedure code 00100 to 01999, plus the addition of a physical status modifier. Okay? So you have 6 choices, okay? So the way that you're going to write your code is you're going to write 00100 P3. Okay? So like this. Okay? So a 0 code is not valid without the P code, the physical status modifier. Okay? Now, look over to that next column where it says qualifying circumstances. Okay? Now, these are optional. You may or may not have these with every patient. Okay? Let me find that in your book here. Here we go. Okay? So, you see the plus. So you know the plus means it's an add-on code, which means it never goes first. So your anesthesia code, your 0, is going to go first. Okay? So let's say that you had to do or a procedure had to be done on, let's say that mastectomy had to be done on a 72-year-old woman. Okay? So you're going to do the 0 code with the P, -P, whatever, okay? And then you're going to add on this 99100. The reason being is because, remember, physicians on an outpatient basis get paid by CPT codes, okay? So there's a dollar amount assigned to every single one of these codes in this book, depending on what kind of insurance it is. Okay? So the reason that you're going to add that 99100 is because anesthesia given to extremely young patients or older patients requires extra precautions, extra time, more complicated, etc. Okay? So this is the way that the anesthesiologist gets paid additional for those more complicated cases. Okay? So in this case, you're going to have the anesthesia code plus the P, and then you're going to add on this 99100. Okay? All right, so let's go back over here. All right, so in your guidelines that start on page 72 in your CPT book, you're going to see time reporting. Okay, there's a time element, which we'll go into in just a minute. You'll see supplied materials. Okay, because sometimes it includes like the trays that they use in the OR and that kind of thing. Okay, you might have anesthesia modifiers, which we're going to go into in just a second. Okay. Here's an example. Okay, so here's the anesthesia code. Here's the physical status. This AA is the anesthesia modifier. Okay, so remember back up here when I told you to download this document and keep it handy. Okay, so if you go over here, if I don't miss it. Okay, so here's your P codes. All right, this tells the insurance company who did it. So sometimes it might be the anesthesiologist, him or herself. It might be under a directed teaching physician. It could be a nurse anesthetist. Okay. That is being supervised by an anesthesiologist. Okay, so that's what these kinds of things are used for. Okay, that's why I said keep this handy. Okay, so we have the anesthesia package. So we haven't talked about packages yet, but when we get to surgery, we're going to talk about a global package too. So the anesthesia package is fluids, monitoring services, and any kind of usual post-op visit. Okay, and then here's your time formula. Anesthesia is based on time. So in every anesthesia report, there's always going to be time documented. Okay, so the way that an anesthesiologist is reimbursed is their base unit plus the time plus any modifying factors. They come up with a number there, and then there's a conversion factor based on the type of surgery. Okay, so you'll see, here's where they do the pre-sedation. Okay, that's where they meet you in the holding room, maybe start your drugs, then during the procedure, okay, and then post-sedation. So they're going to, every anesthesia report's going to have time written down. Okay? So we talked about that. So here's some of those modifiers. So let's say there's unusual. So I'll give you an example of this one. When I had my C-section, usually C-section is a regional anesthetic. My epidural would not take, so they had to put me under general anesthesia. So that would be unusual. Okay. So there's an example. Okay. So here's some examples of the same doctor administering anesthesia and doing the procedure. Okay. Here's those Hicks-Picks modifiers I just showed you about nurse anesthetist, etc. Okay, so in your cases, you're probably going to see these because it's going to say the CPT anesthesia code, the physical status modifier, and then this based on who did it. Okay, so that's anesthesia codes for you. And then next time we're going to start the surgical codes.